So I'm going to talk about the pill to fight the monster, the hair loss. But before that, I would like you to all remember this conference, which will be done by the International Society of Hair Restorative Society in US. This is the first time the International Society is coming to Pakistan, not done by the Pakistanis, but done by them. So it's the first one. And you will see actually all the top names of the world coming over here under one roof and teaching you everything you need to know about the hair loss and hair transplant. With that, I will start with the how to manage the hair loss with one tablet. I think this is one of the things which has made a lot of difference in many people's practice and especially mine. The initial stage of miniaturization, where you have got reduction in the anagen phase, you want to reverse that. So how can you do that thing? What you need is, the goal is increase the blood supply, more follicular enter into anagen phase, prolong the anagen and health scalp environment. So the treatment options for this is, you use a tablet called minoxidil, and it's the minoxidil sulfate which is the active ingredient of that. Its normal duration is in 24 hours, is plasma half-life is 4.2 hours, but because there is an extravascular accumulation, so for topical use or for hair use, you can only use it once a day. So that is the expression of sulfonyluretransferase, which varies greatly in the scalp. So that's why your result can vary from one person to another person. When you use oral minoxidil, it is the SALT 2A1, which is hepatic. So that is why you have got much better response as opposed to the topical, which is SALT 1A1. This was the, Rodney Sinclair is the person who actually started this thing in 2015. And he showed that minoxidil can be really a good alternative to all this. We have used almost minoxidil oral in almost every sort of indication, whether it's a lichen planopilaris, chemotherapy-induced chronic telogen, monolithics, anagen effluvium, or frontal fibrosing. You can use it on everyone, right? But the biggest studies is those 1,404 patients, which was done by Dr. Galvin, and this was the real study, where almost, androgenic patients, alopecia was 82%, and all the other indications was also used. It was mainly used in about 300 patients. It was the single dose. So that means if you started at 2 milligrams, you stayed at 2 milligrams. But in other words, in all the other patients, it was variable. So you titrated. The idea was to hunt for the best dose for patients. So what was the general principles? A female would start from 0.5 milligrams and go up to 2.5 milligrams with an average of about 1.2 milligrams or 1 milligrams as an average. Male started normally at about 1.25 milligrams, and you will go up to 5 milligrams. The minimum treatment is 25 weeks, but my understanding is that I've been using now for over about a year or so, and I think this is one of the very important factors. So I'm just going to skip a few things. What they have done is, when you compound this medicine, you reduce the risk of hypertrichosis. And when, let's suppose, somebody of your patients is complaining of hypertrichosis, which is the commonest complication, you just change it to every other day. So every other day will reduce your complications by 50%. 1 milligram is equivalent to 5%. So if you are giving somebody about 2.5 milligrams, you are almost giving about 10% to 15% of the topical finasteride. We have seen that all those who were assigned 1 milligram of oral minoxidil as compared to the topical minoxidil, the oral minoxidil results were much better. So what happens? When you are giving somebody a minoxidil, It actually starts from sort of the curve which is going on the green one, but when you stop it, it drops down. So there is a progressive nature of the hair loss, so it will join the same curve. So that is what happens in the orange line. You have to restart at number 3 and then you will go up. So ideally speaking, what I would do, if the person is not that cooperative, I would say at least use it every 3rd day if they can't do it every day or every 2nd day. So is it safe? We have seen that the total number of patients out of 14,000, 80% had no side effects. That's a huge percentage. Only 20% had the side effects. And of those ones, if you do to alternate day, it goes to 50%. And if you take these things, you can actually treat them with the male. You can use all these, sort of complications can be reduced. Right. The most important thing is that when you are treating the patients with minoxidil, you need to understand the patient must use it every day at night, so reduce the complication of orthostatic hypotension. The other second commonest is pedal edema. Just change both of them to every other day. And with that, I thank you all.